Welcome, dear all. So, this with a huge pride and happiness that I would like to welcome the celebrity guest of this day. That is none other than Dr. Alay Parikh, and he had made us all proud, and he had made us all happy by securing first rank in the All India level. So, congratulations, Dr. Alay.
Thank you, sir. It's great. It was made possible due to your lectures only. Basically.
Thank you. Happy to hear that. And so, uh, can you tell me about yourself regarding your background, MBBS, MD?
Yes, yes. I have completed both my MBBS and MD from Ahmedabad, Gujarat, AMC Medical
Ahmedabad.
College, Ahmedabad.
Okay. Okay.
And now I'm working basically as a consultant
Oh,
pulmonologist. Basically.
in Ahmedabad itself?
And no, at Baroda, at ESI.
Oh, okay, okay. So you are the preparation for the entrance exam as well as your work, both of them were mainly during the last 1 year.
Actually, to be truthful, sir, last 1 month mainly, basically.
Okay. Last one
Actually,
month only.
yes, my brother completed MD medicine, and he was giving. He forced me to do this. Actually, he joined for DM cardio.
Oh,
Uh, yeah, he gave for DM cardio, and he also secured the
this
rank.
year.
So he forced me to. Yes, this year.
He got cardio
he
this year
forced
or last year?
this year. He got rank.
Oh,
He will be taking.
so your parents, I am thinking about your parents right now. How happy they would be. One cardiologist on one side
There,
and pulmonologist on other side.
it's all
Absolutely
because of them
perfect.
only.
So, how about your family and all? You had told about your brother. You married?
My yes, yes, I'm married.
Okay,
Newly
okay.
married. My wife is
Wife
dentist.
is okay, okay, okay,
Dentist.
okay, okay. So, can you tell how did you prepare during the last few months for the exam? This I
Mainly,
would like to hear from you so that those who are listening, those who are preparing for the next year exam may get benefited from your strategy.
actually, as you know, reading is like everyday reading because the my professor installed in me. You have to read every day what you see in the lecture, whatever patient you see, if you don't understand anything or if you feel further refinement. So I was reading daily, and in Marrow also helps since like that 2x, 2.5x times I can see a updated summary also lecture in just 20-30 minutes. While traveling only, I can complete the whole lecture between study breaks or that between lunch break is also there. At that time also I can complete 2-3 videos basically. If I watch
Oh,
at 2.5 like that
okay.
because only updated is needed because as daily reading is there, not the basic part is covered already basically. Like if I already dealing with solo, I'm pulmonologist is there. No other one is there. So I'm only one taking care of doing all the things basically, and that helped me basically. And Marrow helped me because to like your lectures, IPF guidelines changed that I can easily take see through it. The latest points are there basically, and at last at the end at the time of exam only that sonography videos were added, USG
Yeah, yeah, yeah.
ultrasonography videos were added, like drug induced. The drug part is not that common because we don't regularly diagnose drug induced lung injury,
ILD.
ILDs and
Ah,
all the
yeah, yeah,
that they are more theoretical point of view basically. So
correct.
that were more helpful basically from my
Okay.
side.
So I have started preparing a book on drug-induced ILD also.
Oh, congratulations. I would like to read it.
So, during the last, you told that you have started preparing during the last few months. So, which all textbooks did you refer, or
Sir, I actually mainly Fishman. Basically, Fishman I
hmm,
am reading from since the time of MD basically, and now
MD?
update after I finished then latest Fishman came. So I
Yeah, yeah.
read for the update basically. Okay, now like in effusion they have changed some classifications have been added.
Yeah.
Now some like the scoring system has been added, some like that. Some small changes are there basically.
Okay.
That that's helpful, and because I had studied the last one, this one also helped me somewhat. Yeah, I could read it bit faster basically.
Okay.
That-
So if you take a one particular topic, for example, pleural effusion, uh, you actually listen to the academic classes in Marrow and then look at the textbook, or in the other way, that you first refer to the textbook or then you go to the concerned session in Marrow.
I watched the videos that made me clear, but some points were like ambiguous. Guidelines gets updated regularly, or some statements come like benign effusion statement came just in July or something like that. Conscious state guidelines that came. So that as I'm practicing, some points I am also feeling it. I cannot be sure. Like if another consultant asks, "Okay, please guide like hepatic hydrothorax, what would to do, when to tap or when not to tap, or when to give ICD or not give that." Some points, so I refer at that time textbook, unless mostly videos take care of it.
Okay. So do you make notes while watching the video, or just you hear it and go to the next one?
Uh, there made notes during cancer only. Other parts I don't make notes. Basically,
Okay.
it's cancer because I'm not dealing regularly. Cancer.
Okay. Okay. And we have given the notes along with the videos, right? So you just is it useful?
It's useful, sir. But let's as I told him, I watch video very fast. Basically, that the more videos are more,
Oh,
and especially
you
2x.
speed up the video.
Yes, 2.5 to sometimes 3 also. So like
The playback
90
speed
minutes
can
with
be increased up to 3x.
3x. That's the it is that's very
Oh,
helpful if you are just scrolling through it, that
yeah.
latest points. And we can
So we can finish
cut
the
down the speed.
90-minute video in 30 minutes.
So very less, 20 minutes or 10 minutes, 20 30 minutes. Because
Okay, okay.
some parts like you are
So
giving
that
summary.
interview. Hmm.
Hello? Yes. The summary part, if I have understood already, then summary part also I, and if only sometimes only what summary part only. Basically, a summary part is good. That's it covers the whole thing basically. The latest
Okay.
points.
Uh, it covers gives a complete recap of the entire topic.
That topic. That's the helpful part.
So okay. Um, we have the routine of discussing some MCQs at the end of every session. So, do you find it useful after finishing a topic? We will cover a couple of questions, MCQ questions,
Yes, yes,
based on that one
that
particular.
that's useful because it's make you just understand what the kind of question they ask. Basically, let you think
Okay.
what points, if you are giving exam, if you are reading something, what you have to focus on, something like that. Basically, just like if the question generally the follow the same basics, then they just
Yeah. Correct.
twist and turn around like that. That's the
So, how was the questions in this exam? Was it just like a straightforward one-word type of questions, or will they give a case scenario and then make you lose the time because you have to go through the entire question, entire story? Is it like that?
Nee, most of the questions were direct that I've heard.
Direct.
That like 2-3 lines questions were there, but if you prepared for some anything any other exams,
Hmm.
then they are more like MRCP, or that the questions length is very big.
Yeah,
Like
yeah.
2-3 lines doesn't matter. Take.
Okay.
And most of the questions
So,
were one liners.
okay. So it was the questions were not that big. It was
No,
straightforward
the
from
questions
your
were not straight.
experience.
Yes, yes.
And one more thing, Alay, is it the questions from pulmonology alone, or how many, if you take out of 100 percentage, how many percentage will be from pulmo, how much from medicine, or how much from critical care, anything like that? Anything from
Uh,
cardiology?
yes. The most of the questions, like 50% were like exclusively pulmo, basically 50 to 60% I can say
Hmm.
exclusively pulmo.
Okay.
20-30% were mix of another specialty like with rheumat background is there, or
Hmm.
some main the ILD part were through like some rheumat or drug which we use, not used by us, mainly rheumatologist uses those drugs basically, like
Okay.
that rheumat background ILD was there. And 20-30% well from critical part. But if you do if you daily practice pulmonology, you just take care of all those patients basically, not very detailed basics of critical care was only there, not very detailed. The only question I felt difficult was were from
Anything from medicine?
neurology. Yes, neurology was bit difficult as I'm not taking care of since last 1 year. Neurology, exclusively neurology patients, basically. 2-3 questions from neurology were there,
Okay.
and one
So how
question of
many
genetics
percentage
that were a bit difficult for me, and one
neurology
of
and
genetics.
medicine?
Medicine 5-10 questions mix like exclusively medicines. More with pulmo backgrounds were there,
Okay.
pulmo critical care, but exclusively medicine questions will be 10-15 only.
Okay.
And in that neuro part, I felt a bit
Okay.
difficult because I'm not taking
And nothing
just
from cardio.
cardio will be there, sir, but well, basics, not detailed cardio, like not eco findings were there. Basic cardio
Okay.
was there. 1 to 2, not that detail.
So from okay. So around 60-65 percentage pulmonology, then 15 to 20 percentage mixed between pulmo and medicine. Then the rest is
Yes.
critical care. Is it like that?
Yes, sir. Yes, sir. The critical care, I think, is like in my mind, critical care is mixed with pulmo. Like critical care, like if you ask about oxygenation or ventilation,
Yeah, yeah, yeah.
that's in my mind is like it's
Hmm.
not critical, it's pulmonology because I'm regularly dealing with it. That's like ventilation. They ask many questions about ventilation,
Yeah.
but that's what you do daily in practice basically. That's goes with
That's
the flow.
absolutely right. Yeah. Mhm. So
The only one I
can you tell
found
us
difficult
about
was
the last
genetics.
few days or last minute? Okay,
So
okay.
last minute,
So
your
genetics, how many
video,
questions were there? Couple of.
one, two questions were there, and one was something very difficult. I just I could not find out about it. What was they were meant to ask.
Okay, okay. So how was the last few days preparation? Last minute that we called.
The last minute mainly just uh, taking walking through your videos fast. I almost finished that almost 670 videos were there at that time. 70 now 75 77 would have been there.
Yeah,
At that time
77.
70 something. I finished almost all the videos in as I was working. I could not take the that 2 days. I took the leave and I finished all the videos. 3x speed. I just
You
completed all
finished
the
all the
videos.
videos in 2 days leave.
Yes.
Oh, wow. So your work time was from 9 to 5 routine.
Routine, sir, starts at 9 till 7, basically. 7, daily.
Okay. You use
Mainly
Marrow
5,
during your
but
travel or something like that?
yes. Marrow I use basically Pulmo part and videos of Dr. Rakesh Nair, medicine
Okay.
basically.
Yeah.
Because when medicine latest, because I cannot read that much medicine nowadays. Now, like
Mm.
hypertension, the guidelines get changed. Diabetes
Yeah.
basics they change it,
Yes.
updated.
Classes are extended.
Then yes, that the basics just get cleared up basically.
And did you attend the mock test that we often give? Was it
Yes, yes,
useful?
yes. As I give
Help in
mock test, attended both the mock
okay.
tests basically.
Does that help in getting a time management like that?
Yes, and time management, तो I feel ke, that's easy because but more of the what you are lacking, that I also we get acquainted. Okay, which
Okay.
part you are lacking it, then the
Yeah.
because it covers all the part. Like I got first time when
Yes.
I came to know that biostats is some difficult for me. Then this cancer part is lung cancer, because I am not knowing new drugs or cancer like that, because I'm not dealing with daily. I'm not like
Yeah.
immunotherapy. I'm not
So the
giving, so that.
exam, the mock exams helps in getting a self assessment, right?
Yes. Which part you are lacking, and you can focus on that part. Or like you
Yes.
said, if you want to read from Fishman, you have to read from that only. Or anything guidelines, new guidelines, you have to read that guidelines.
Okay. So basically, the INI exam has got two parts: the exam as well as the interview. So we were discussing about the exam part now. So how was
Yes,
your interview like?
yes. Interview was good. Some questions were there that which I couldn't get answer. Basically, most of them were like, what is the latest, or any
How much time did it take?
10-15 minutes it took. 10-15 minutes.
So 10 to 15 minutes. How many faculties were there? Three.
Actually, I was the first one to give the interview. I was the first person to give the interview at that in the morning.
Oh,
So at that time, 4 people were there.
okay. That was an online session, right?
Yes, online session. It's like we are talking right now, sir.
Okay.
That's the
On the interview side, there were four faculties.
yes, four faculty at that time. Four and one sir last time. At the end, one sir came there.
What were the questions like? Do you remember?
Sir, they cover almost all the things from just they ask about basics, then what you do, and they ask from that background. They start and they uh, take it to that what is the latest of that thing, and they just covers all the things, like from TB to
Oh,
sleep to like. But as if I once asked you at the mock interview also, if they will ask for this intervention, but intervention gladly they didn't ask that much. The latest of interventions basically.
okay. Anything about the publications, articles, journals, new trials?
The the trials they ask, and drugs they ask.
Okay.
Publication, my thesis, the title only they ask basically.
Oh, they didn't go into deep into it,
No, they didn't go in my thesis.
but they covered almost the entire areas in 15 to
Yes,
10
they
minutes.
50 minutes from PFTs to COPDs, and they covered all the things. They
Okay.
critical
And
care
in
also they were asking.
okay. Oh, so they covered everything. I forgot to ask one thing. How many questions were there in the INA exam, and how much did you attempt? This is for the information of the upcoming
Then,
students.
88, I think, if I remember, 80 questions are there, and I attempted almost 75 or 76.
Okay, so you should target something above 70 definitely.
70. I think 70
Very
is
good
the,
one.
unless you are very sure, okay, whatever you
Hmm.
target, yeah, right, you have to go for 70s at least.
Yeah, yeah.
70,
Go
above
more than
70.
that. Yeah. Only then you can expect a higher rank.
Higher rank, basically.
And one more thing, how much time was there for the exam? And was you able to finish it in time?
Yes, this time I was able to finish it in time, actually. I could go through once again. That one time was left. I could go it,
How
revise all the things.
how you covered the
I
first
think
round in how much time?
I think about one. If I remember it like rightly, it's 180 minutes, or I think one 1.5 or 90 minutes is there, something like. I covered it in 60 70 minutes between first time
Then you
and
got 20 minutes for a repeat
back
revision.
there. Repeat. Yes,
Okay.
15 20 minutes I got.
Okay. So any advice for the upcoming students for the coming exams from your side, from your experience?
I think every it's like I can only tell that just read, prepare whenever you read it, whatever you see, and use app or Marrow, any video you use it at that time. That's helpful. Cover your basics clearly. That's the main thing.
Correct.
That's what they are. Whatever you see in the hospitals, that's the number of patients, and you have to just study it. Okay, what's that? That's the most helpful thing. If you prepare like 3 years MD duration, you study it regularly, and then there is no problem basically to clear.
Correct.
And just regularity is the main thing. If you read
Okay.
regular readings is the
So
main thing basically.
how was your study time in the early morning or late night? What kind of study was from your side?
So I studied whenever I got time. Basically, in most of the time, I have a habit like to read during at night. Whatever felt okay, during the day, that which the topic or something new has happened in the patients. What I saw, something new, okay, which generally I have not seen. Like if TB is there and isolated hand TB comes, then I will read that part. Okay, how much isolated
Okay.
TB, hand TB, the presentation, it's like that. Some it doesn't happen
That's a
regularly,
good
but
thing
once,
actually.
two,
What
three.
Dr. Alay has told. This I tell my students also. Whatever cases you see in the ward regularly, you have to go through it when once the ward rounds or duty is over. Then you will remember such cases much more easier. So thank you for the time.
Thank you, sir. Thank you very much. I just wanted to thank
Sure.
my parents and all my teachers, basically my parents and my brother and my wife also there, for all the support they have given me till now.
Absolutely. And once again, congratulations from myself and also from the team Marrow on your brilliant success. And convey our regards to your cardiologist brother also.
Thank you, sir. Thank you.
Okay, Ale. All the best.